Understanding ovarian cancer. It's the fifth leading cause of cancer death among women. Joining us now to talk about the symptoms and hope for the future is Dr. Robert Holloway, a Florida-based leader in gynecologic oncology at Advent Health. Doctor, thank you for joining us.
Good morning. Thanks for having me this morning.
Let's start with what is ovarian cancer and why is this an important topic to talk about?
Ovarian cancer is obviously one of the major cancers of the female reproductive system that gynecologic oncologists deal with. What we call ovarian cancer oftentimes actually is fallopian tube cancer. These cancers typically can start in the fimbria of the fallopian tube, which is the inside the abdominal cavity sitting on top of the ovary. It's the number two in incidence for reproductive tract cancers and the number one cause of death, although currently being eclipsed by uterine cancer in the last few years.
What are then some common symptoms that women should be looking for?
This is really an important topic to educate young girls and women about, that the signs and symptoms of ovarian cancer are oftentimes confused with other body systems and are often ignored for a long period of time. Ovarian cancer has often been called the silent killer of women because the symptoms are subtle and easily explained away to other diseases such as irritable bowel syndrome or constipation, and ignored for some period of time. So I think education about this is important, that if you're having bloating, digestive discomfort, pain with intercourse, urinary frequency, pain with urination, at a very minimum, this should be brought to the attention of the gynecologist and get a pelvic exam.
Why is early detection so challenging?
Are oftentimes confused for gastrointestinal symptoms, and there is no specific screening test, for ovarian cancers. Our screening guidelines are an annual pelvic exam, pay close attention to signs and symptoms, and if anything's changing that is not routine for the patient, then bring that to the attention of your gynecologist. Even if your primary care doctor is suggesting you get a GI workup, it's still fruitful to get a pelvic exam from the gynecologist and potentially an ultrasound screen of the uterus and ovaries.
I want to talk about that new hope for the future. So can you tell us about the OnPrime Phase 3 trial? And we hear it's currently accepting new patients right here in Florida and with other locations all around the country as well.
So the OnPrime 3 trial is a clinical trial for what is termed as platinum-resistant ovarian cancer. The typical treatment history for patients with ovarian cancer, it's oftentimes diagnosed at a late stage. We just described that we don't really have good screening tests, and unfortunately, by the time a patient is having gastrointestinal symptoms, that oftentimes signifies spread of the disease. So we mostly, 2/3 of patients present with advanced disease that requires chemotherapy and surgery. Over time, oftentimes ovarian cancer relapses. Even though we may get patients into a clinical remission, it oftentimes relapses and eventually becomes treatment resistant, and we term that as platinum resistant, as the platinum compounds are the main chemotherapy agents used in ovarian cancer. So that is really the need that we've had for the past several decades to identify more active treatments for patients with platinum-resistant cancer.
Thank you so much for joining us and explaining about the importance of staying on top of this. We appreciate your time.
Thank you.
And again, you can scan the QR code that's been on your screen, or you can go to genelux.com.